there are two kinds of advanced procedure we still can do before we think about surgery. One is for the disc problem and the other is for the joint problem. Now for the disc problem, we do percutaneous discectomy. Percutaneous discectomy. That means through a needle, we can decrease the pressure of the disc. Now it's not a big procedure. It's a very simple procedure because nowadays there are different ways to enter the disc. It's very safe. If you think this disc is the source of pain, so you enter through the disc with a needle. And once you are there, you put a contrast and see if this disc is the source of pain. The patient is still awake enough to give you the idea that once you pressurize the disc, the person says, yes, this is the pain I feel. Now you can give him after that a little more sedation. You can take a disc mechanically out, or you can ablate the disc, evaporate the disc and clean it. The second part of this same percutaneous discectomy is while you are coming back, when you are through that hole or the weakened annulus part, the ligament part, you can ablate it by heating it. So it will denature the protein structure, and as a result of that, that area becomes strong. So this is the percutaneous discectomy for the disc. It doesn't take much time, it is safe, it has to be done naturally by those people who have acquired the expertise. The second advanced procedure I want to mention is the facet joint. If the facet joint, you did diagnostic facet joint injection either by blocking the medial branch or the nerve going to the joint, or getting into the joint and giving some relief, but the pain still keeps on coming back, you can do radio frequency ablation of those nerves. Now, radio frequency ablation of those nerves is again a very simple procedure. The specialized kind of needle goes over the nerve which is going to the joint. This time we are not going into the joint but on the nerve, and then connecting it to a radio frequency machine. The radio frequency heat will create a lesion in the nerve. Now that lesion will cause a discontinuity. Remember, this nerve is now doing the only function of carrying the pain message to the brain. It is not providing any other good function, rather it is now just carrying a pain message to the brain. So by creating a lesion through radio frequency, you are causing that discontinuity of message, and the person can now live relatively longer pain-free window in which you can strengthen his muscles so that the facet joint loading is decreased and the facet pain can be better for a longer period of time, because the nerve will regrow, but up to 6 months to 1 year he can or she can live without much pain.